At this very moment, as you are watching this, your legs and feet might be yelling warnings about your heart, but you are entirely disregarding them. It's estimated that over 6 million people in the United States are living with congestive heart failure. The majority of these individuals were completely unaware that their swollen ankles or chilled feet were urgent distress signals from a failing heart. Here's what's genuinely shocking. Contrary to what you see in movies, chest pain is not often the first sign of heart failure. Instead, it reveals itself through symptoms that 94% of individuals ignore as being nothing more than the natural process of aging, being overweight, or standing too long. That swelling in your ankle you blame on new shoes? The numbness you attribute to sitting too long? These might be your heart's final attempts to attract your attention before it's too late. If you're concerned about your health, click the subscribe button and enable notifications, because here we reveal the truths that nobody discusses. And I want to know if you're with me. If this video resonates with you, type 1 in the comment section. I'm going to discuss 12 scientifically backed symptoms that manifest notably in your legs and feet when heart failure first occurs. This is not a random occurrence. Medical research has unequivocally shown a connection between each of these symptoms and the gradual decline in your heart's capacity to circulate blood. Identifying them early could very well mean the difference between life and death. Please stay with me because the 9th symptom occurs during the night and affects 78% of individuals with heart failure, yet nearly no one makes the connection to their heart. The 12 urgent warnings, your legs and feet, send one. Persistent cold feet. Most people dismiss cold feet as poor circulation or needing thicker socks. But when your heart begins to fail, it must prioritize the destination of the minimal blood it can pump. Survival instinct kicks in, prioritizing blood flow to vital organs, kidneys, lungs, heart, and brain. Your feet are relegated to the very bottom of the list. Research. In Circulation Journal found that patients with decreased cardiac output regularly indicated cold extremities as one of their initial and most prominent symptoms. This coldness is most noticeable in the feet because they are the furthest point from your heart. The key difference is that heart failure-related cold feet remain consistently cool regardless of what you do, even with warm socks and shoes. Pitting edema test. This is a straightforward test you can perform now. If you have swelling in your legs or ankles, apply a hard pressure with your finger to the swollen area for about 10 seconds, then let go. If you notice a deep indentation or pit that continues to exist for several seconds after you withdraw your finger, you are looking at pitting edema. Research published in the American Heart Journal links pitting edema directly to right-sided heart failure. When the right side of your heart fails, it can't properly pump blood returning from the body back to the lungs. This causes a significant blood backup in your veins, forcing fluid out of your blood vessels and into surrounding tissues. The retained indentation shows how saturated your tissues have become. Sudden leg muscle weakness. This is more than just feeling fatigued at the end of a long day. Groundbreaking research in Circulation. Heart failure showed that chronic heart failure patients experience skeletal muscle weakness that restricts routine physical activity. When your heart cannot pump blood efficiently, your leg muscles are starved of the necessary oxygen and nutrients. The research found that patients with heart failure have lower levels of key proteins like myosin heavy chain protein in their muscle fibers, meaning your muscles are literally losing the protein machinery required for contraction. If climbing stairs that used to be simple suddenly makes your legs feel like jelly, your heart may not be providing adequate nourishment to your muscles. 4. Rapid weight gain from fluid. If you've gained 5 to 10 pounds in a span of just a few days, especially when accompanied by swelling in your legs and feet, this is not fat accumulation. It's your body's desperate attempt to cope with a failing heart that cannot circulate fluid properly. Mayo Clinic. Proceedings recognizes fast weight increase as a primary red indicator requiring quick medical treatment. This abrupt weight gain is fluid that has been retained, not fat. Due to gravity, the weight concentrates in your lower body, causing your calves to feel tight and your shoes to stop fitting. This constitutes a medical emergency that requires prompt evaluation. 5. Bluish dusky legs. Cyanosis. When you look down and see that your legs have taken on an alarming bluish or dusky tint, medically called cyanosis, this is a visually obvious and medically significant symptom. ESC heart failure identified cyanosis as a significant peripheral symptom of congestive heart failure. This color change occurs when oxygen-deficient blood begins to pool in your extremities, particularly the lower legs, ankles, and feet, because a weaker heart struggles to overcome gravity. This blue color is your body's way of letting you know that your tissues are physically starving for oxygen. Persistent ankle swelling. Ankle swelling is frequently one of the very first warning signs patients experience. As your heart weakens, the pressure in your veins increases as blood backs up. This increased pressure forces fluid out of your blood vessels and into the surrounding tissues, with your ankles becoming the primary gathering point due to gravity. The concerning sign that distinguishes this from normal swelling is that the discomfort does not disappear with rest or elevation. It remains day after day and frequently becomes noticeably more obvious as the day progresses. JACC research confirmed ankle swelling as one of the most dependable indicators of how heart failure will worsen over time. Slow-healing leg-foot wounds. A minor cut, scrape, or sore on your leg or foot that should normally heal within days but instead persists week after week reveals a critical issue with circulation and oxygen delivery. A study in JAMA showed that patients with heart failure face greatly delayed wound healing due to 3 factors: tissue hypoxia, lack of oxygen, reduced immune function, and hampered circulation, preventing healing components from reaching the site. Since the healing process is extremely oxygen-intensive, the reduced blood flow causes even tiny wounds to become significant, long-lasting difficulties. 8. Leg cramps, heart pain on walking. Claudication. After only a few minutes of walking at a typical pace, the muscles in your legs start to cramp and hurt, compelling you to stop and rest. This symptom, called claudication, is one of the most functionally limiting symptoms of heart failure. As your heart fails, it cannot pump blood effectively enough to satisfy the oxygen demands your leg muscles place on it during physical activity. The legs, being large and metabolically active muscles, are the first to suffer from this reduction in oxygen supply. This gradual limitation demonstrates how the deterioration of your heart's function directly affects your muscles' ability to work. Nighttime restless legs. This is the symptom experienced by 78% of heart failure patients that is almost never associated with the heart. You finally lay down for the night, but your legs start to twitch, cramp, and experience an unexplainable urge to move, making sleep impossible. Studies in sleep medicine reviews reveal that the cause is fluid redistribution. Fluid that has built up in your lower legs during the day starts to move around when you lie down, because gravity is no longer pulling it down. This movement of extra fluid back toward your core circulation compresses nerves and alters electrolyte balances, causing the tingling, burning, or crawling sensations that mandate movement. Symptom 12. Worsening varicose veins, skin changes, and numbness. Worsening varicose veins. Existing varicose veins that suddenly get significantly worse, or new ones that arise unexpectedly, could indicate a serious underlying problem. Heart failure causes a significant increase in pressure throughout your entire venous system. This elevated backward pressure from the weakening heart overloads your leg veins and their already weakened valves, causing them to fail more quickly. Shiny, thin skin. If the skin on your lower legs and feet appears exceptionally shiny, almost stretched tight, this isn't merely superficial. The fluid retention is structurally modifying your skin. Excessive fluid stretches the skin beyond its normal limit, flattening its natural texture and resulting in a taut, shiny surface, a visual diagnostic signal medical professionals frequently use. Persistent foot numbness, tingling. This uncomfortable and persistent sensation is caused by 2 mechanisms: the direct compression of nerves due to swollen tissue, and a more worrying circumstance, a decrease in the amount of oxygen supplied to the nerves themselves. Both result in the nerves misfiring sending misleading messages to your brain that you interpret as numbness, tingling, or pins and needles. Conclusion: act fast. Your legs and feet are highly developed early warning systems that have the ability to identify heart failure long before it becomes suddenly life-threatening. Every single one of the symptoms we've covered is your body's urgent attempt to convey the message that your heart requires immediate medical assistance. It would be irresponsible to disregard these symptoms, as they are not trivial inconveniences. They are evidence-backed indicators of an illness that affects millions. The ability to recognize these signs at an early stage can undoubtedly be the difference between an illness that is treatable and a medical emergency. If you recognize several signs from today's discussion, that swelling that won't go away, those chilled feet, that unexplained weight increase, you should not wait for the symptoms to become more severe. Contact your doctor immediately.